What does it mean to be a teenager? This is a question that these young people answer as they pride themselves in being teenagers.
Like nothing, because I'm a hustler. I hustle.
It's the way to go. But now I've learned even how to smile with people.
This is Naguru Teenage Information and Health Center. It is more than a health resource center, to many rather like a paradise. This is a place where teenagers meet. It is a place where they get to be themselves. The center offers these teenagers hope and peace of mind. Here, the teenagers engage in dancing, rapping and singing, poetry,
let it shine or rain on us. We shall stand strong and empower fellow youths out
and
there.
some just relax. Well known for its work in the field of adolescent sexual and reproductive health and rights, the center was established in 1994.
Naguru Teenage Information and Health Center is a non-government organization. It has been in existence for 25 years, I should say. It started way back in 1994. And we started as a small community-based organization, but we have grown over the years to become an NGO. And I can consider that we are a pioneer organization in providing adolescent sexual and reproductive health services. These are services that are geared towards improving the reproductive health lives of young people.
The World Health Organization defines a teenager as an individual between the ages of 10 to 24. The transition from childhood to adulthood involves dramatic physical, sexual, psychological, and social developmental changes, all taking place at the same time. In addition to opportunities for development, this transition poses risks to their health and well-being.
There is a lot that is happening in their bodies. There is a lot that is going through their minds. Some of them get confused along the way, and they need support and guidance. But we also believe that these young people, it's not about pushing things to them. Give them information, guide them, and they make informed choices and decisions about their reproductive health lives. Like we know that, and you read around, there's a lot of teenage pregnancies. Many of the girls are getting pregnant when they are still young. They find a baby taking care of a baby, which is not good. But how did they end up there? It means that there was somewhere, there was lack of guidance, there was lack of information to be guided on what to do. So Naguru exists to give young people information regarding reproductive health matters, such that they can transition through this stage to move into the stages of being adults when they have not fallen into unfortunate acts or situations that might have an impact in their future lives.
Naguru Teenage Information and Health Center has created an environment for young people's access to and use of appropriate health services and commodities that respond to a number of priority health conditions.
Here there are different services that we provide. We offer medical services, that is people who come for treatment, medical treatment for these minor ailments, mothers who come for antenatal services, those who come for postnatal services, family planning, immunization of their babies, and counseling.
Services, basically most of the services that we provide are reproductive health related services. And here we look at young people coming for HIV counseling and testing. Then we have those who are HIV positive, so we provide HIV care and treatment. That is ART. and that is being supported by our partner, the main health facility here at Kiswa. IDI gives us technical support in the training of the health workers and the counselors, and also some of the ARV drugs. Of course, we also have family planning commodities which we give the young girls. Of course, after some counseling and discussions, we realize that, well, you know, issues of contraceptives is very contentious here in Uganda, but most of the young people are sexually active. So we have a discussion and dialogue, and we share with them the various contraceptive methods that we have, and then they decide on which method they can go for. Then we also have general medical treatment, that is those who come with malaria, skin-related issues which are related to hygiene, and it's very common among the young adolescents, the 10 to 14. So much is happening in their bodies, things to do with menstruation, body changes and all that. So we need to have support to be guided on how to go through those early stages in their lives.
It has been a long time. I think it has been a year now, because I used to first come for treatment. For treatment, I started coming for family planning, and now as mentoring.
We have free medication around. Yeah, so sometimes you may be broke and you don't have the money. You just come and meet the doctor, they give you the drugs.
Getting information from these young people is not easy because they have trust issues and some lack confidence. But the people who talk to them, the peer leaders, are as young as they are. We talked to Kateme Immaculate and Wabusa Keith, who are trained to speak to these young people using the language they relate to and package their communication in a way that appeals to these young people.
You know, young people are stubborn beings, so sometimes they might say that maybe if I tell that kid about what I want, maybe they kind of shy away. But sometimes when you approach them, because different people have different attitudes. Someone might come, but they really don't feel well, and they feel like what they have, it's like they wouldn't love to share it with anyone, unless when they enter the treatment room. But the way you approach someone and the way you talk to someone also gives them that space, you know, that to share with you or to push back. Yeah, but when you talk to them, I think politely, or when you receive someone, because at the client care, that's when everything begins. If you're a client care and you give some bad attitude to a client, or you're not, let me say, or you're not hospitable, they'll find it very harsh and they feel like, is this really the right place? That's why you have to be so much hospitable, so that the person you're talking to also gives you time and also kind of trusts you. The more you interact with someone, that's the more they also open up to you.
My job, it entails offering healthy talks to different peers, because when they are administrators here, elderly people, but teenagers feel very free when they talk to a fellow teenager. So my job, it's all about communicating to the youth, offering a friendly service, registering them so that they go and see the doctor, directing them to different rooms where they're supposed to attain the health care.
Because when you talk to someone, you need to have knowledge about what you're going to talk to them about, rather than just have someone approaches you and you start telling them about something you don't even know, which makes it different. So we are trained so that we are equipped and well packaged with information, whereby we can also guide other young people about certain things. And we also talk that we don't know everything, whereby you have someone you could rely on. In case you don't know about something, you refer the client to what? To the counselor or doctor for more information.
After a week long of health checkups and treatments, which includes counseling among others, these young people wind up the week with a fun-filled Saturday in the Teens Club. The Teens Club is a safe place for young people to meet and socialize. Here, they engage in a variety of activities which include drama, dance, singing, poems, hand skills, among others. We met up with these young people on one of the Saturdays to see what exactly happens at the Teens Club, and they shared their favorite moments.
For me, they had called me to take my boys to dance. They were having a certain party. So after them performing, then one of the officials here picked interest in me and my group. And he said, we like such talents at our center there. Would you take a visit? I told him, it's good if you can welcome us. Then he directed me, he also gave me his contacts. Then one of the Saturdays we came here, we saw it was fun, we are learning. So I picked interest and I got to know more about my health, let's say learning about HIV, these teenage pregnancies. Okay, all in all, I got to know about SRHR, that is the Sexual, Reproductive Health and Rights.
Joining the club, I joined it like on 2019 when we went in for a camp, and then they gave us that opportunity to come and join the club. And you know, every teenager qualifies for the club, so I just joined automatically as long as you have the passion. Yeah. The most fun thing we do here is learning, but we get to build on our talents. We have people who sing, we have the poets, we have those who act. I believe I'm one of those who act and sing as well, and do the poet at times.
People don't know a lot. But when you come here, you learn a lot. Because most of them came when they are shy, they couldn't talk, but now they have changed. They can talk, we can interact, we do dancing, we do modeling, we have snacks. So you get more information, you end up learning that my problem is not a problem. People went through a lot than I went through.
In March 2020, it dawned on these innocent souls. The center closed due to the enforcement of the presidential directives to lock down the country due to the pandemic of COVID-19. Many lost hope as others were challenged. It is during this time that Akia became pregnant, and here is her story.
Because I was in my Form 6 class, so I got some work to do maybe to move on with life. Then when COVID just came in, because people stopped from working, and yeah, when I had to stop working, I was home, and from being idle, this is how I ended. I ended up getting pregnant and stuff, but I was kind of idle and all I did was engage in being out with my boyfriend and all that. So before I started this family planning, when I went, the doctor told me about it. So I talked to him and was like, it was okay for me to continue with it. But I started the family planning of 3 months. From there, like when I was supposed to come back for the second time, that's when this COVID was coming up. So I think there are kind of some changes here. So I came and nurses were not around because like they're enforcing the things of Corona and stuff. So I wasn't able to get it for the second time. I think that's how I intended that. But after me missing that, then I tried other places, but because I wasn't I'm not that contented with these clinics, because some clinics really like expired drugs, so I couldn't go to that clinic. I only trusted here. I never did get pregnant this early, and of course after getting pregnant, also I never did anything like an abortion, so the best was for me to just keep it.
Dreams shattered. Others have their own stories too of how the pandemic has affected them.
During that lockdown, when it was still tough, we could not do anything because we had nowhere to perform it. No one could even call you into work, come and perform in such and such a place. So I saw that it was expensively affecting me because I had to feed those guys. I had to get where they could sleep. So I saw I'm running a lot of expenses, and yet also my job that I had stopped because I had got a job and I could work with a certain school as their transport officer. So when they closed the school, we also stopped.
Like back in our community, we have seen many girls getting pregnant during this lockdown. And when you get to meet up with most of them, or some of them, they'll be saying that, man, I didn't have any access to, let me say, condoms or contraceptives. You find that many young people stay far from the health facility, and whereby transport charges were doubled. And in the beginning, public transport was in place. So you find that some young people were stranded, maybe at friends' places, whereby they couldn't move. And this age is a sensitive age, whereby you're going to your friend's place, let me say the opposite sex. Somehow, something might happen. You find that they're engaging into some activities they wouldn't have wanted to go to.
Oh goodness, I lost my job because all my hopes were like, let me get a job, maybe I get a side business before campus. So we used all the money, maybe in the first month, second month, we used all the money. I lost a job. I lost contact to many people, whereby everyone will be telling you, are you wait after COVID?
At administrative level, things were not as smooth as they looked. The program's director of the center gives us an insight on how the pandemic affected the center at large.
COVID has affected us greatly. It has affected us greatly. I can say one of the biggest areas that it has hit is access to adolescent sexual and reproductive health services. For instance, when it had just hit and the lockdown came, everybody was scared. And you remember the presidential directive was that everything should stop and we listen to the enemy out there. So the teenage center closed for up to 2 to 3 weeks, if I can remember. 2 to 3 weeks is a long time. In a day we see 120 young people here. So in those 3 weeks you can imagine how many young people missed a service. Either they missed to come for a refill for art because appointments had been done and they had missed. How many missed getting a family planning method? And so how many pregnancies could have been got at that time? I am not surprised on what is happening because every day I read the paper and what you hear, girls are getting pregnant left, right and center. We, even in terms of operations, we realized that we had to change our mode of operating because we would have so many young people coming and sitting in the waiting area. But now you have to social distance in the way they are sitting. So you are limiting the numbers of young people who come in a day. Hours of working hours had to change because the staff also had to go back and beat curfew deadline. We had a challenge, I remember, in a week when we had just opened after the lockdown. We were running out of supplies, drugs and supplies. And some of these commodities could not be got because our suppliers also didn't have them in stock. Currently, these PPE, the personal protective equipment, the masks that we are putting on, the sanitizers, the temperature guns, all those things were never budgeted for, and you needed to revisit your budget. And being donor funding, it means you need to request for a reallocation on the budgets, which also is a process that takes time. So there was a need to change. We can no longer go to do outreaches as we used to. You know, though young people are coming, but you get more young people when you go into the community, and you are able to provide the service to so many. But now you are cautious and you limit because of the COVID outbreak. So when we go there, we see a few, and also the cautions that you have to have a mask and things like some of these young people even don't have and can't afford the masks. So all those issues have impacted on our mode of providing services. The service providers cannot move. Some young people want to be touched. I have a problem, I have a pain here, you have to. The service providers need to first look for gloves. So there's a way it has changed the way people socialize and interact, but even at the center, unfortunately, we can't allow a young person to come in without a mask. But of course, we try to provide to those who are very needy and don't have the masks.
The center, to successfully continue with its work during this coronavirus period, has embarked on the standard operating procedures as they have been laid out by the government and the Ministry of Health. Emphasis has been put on facial masks, washing of hands, taking body temperatures before accessing the facility, sanitizing, and social distancing. Sexual and reproductive health and rights is the right to have control over and decide freely and responsibly on matters related to sexuality, including sexual and reproductive health, free of coercion, discrimination, and violence. Taking into account that in this case the ages is 10 to 24, how are the rights of these people protected and how is information given to these young and sensitive ages?
When it comes to rights, I totally agree with you. It is a contentious and sensitive area in Africa. And our approach is that we need to engage the parents and the guardians about this issue of rights. It's not that because to them it's like we are actually making these young people grow wings and feel that they have their rights and they can do whatever they want. And that's not what Naguro, the Teenage Center, is promoting. It is basically, first of all, we need to appreciate that these rights do exist. It's just that I think they were never being promoted from time immemorial, but they are there. And Uganda as a country has been part of the development and they rectified in terms of signing to these rights. So we give these parents information, most especially those who escort their young people here. So we do counsel the parents, tell them the advantages of promoting young people's rights. And the young person themselves and the young people, though we are telling them that they have rights to these things, but there is a bit of responsibility, being responsible in whatever they do. It is also key that we communicate and discuss these issues with them. It's your right to decide how many children, who to get married to, or who to wed and things like that. But again, the issue is, are you ready for all? Do you know what you want to go into? Have you ever thought about it? Those are the things that we also... So we don't just throw it and leave it at that level. We go into deeper in understanding the whole concept of rights and how it can impact on you if you just dive into it without you taking responsibility about it.
And when we began implementing this strategic plan 4 years ago, we committed to increase the understanding of sexual reproductive health rights among the young people. And when we conducted a baseline study, then that was 4 years ago, because this is the 5th year we are closing. When we conducted a baseline study then, the baseline study revealed that only 20% of the young people we interviewed, only 20% of the young people had some bit of knowledge about sexual and reproductive health rights. And how we were able to know this. For every young person we interviewed, we asked them to at least mention 3 rights that they knew. And the results were evident. Only 20% of the young people that we interviewed it was done in central Uganda, northern Uganda, eastern Uganda. There are only a few of young people who could actually tell their rights. Now, the end-term evaluation has given us good results. We're having a very huge number of young people now aware of their rights. Yeah, in 2015 we had 20%. In 2020, 74% of the young people that we interacted with are able to mention at least 3 rights. And I think this is a very, very big achievement on our side. So, one, we have engaged young people. Our work is young people-centered. Young people-centered. So we have created spaces for young people to express themselves. We have the peer program that continuously empowers young people on their rights. We have young people forums. We have young people clubs that meet routinely on a weekly basis to learn, to share, to equip themselves on their rights and so many other. They're also equipped on other issues that surround sexual and reproductive health.
Basically, like let me put it as like a teacher. of health. Yeah, there's where you package information according to the given audience, the age bracket. If the information you give to someone within 10 years, 12 years, 13 years.
Are you an adolescent? It is high time you get to know that you are not alone. You have peers you can relate to, and they are at Naguru Teenage Information and Health Center. They are speaking to you.
I always tell myself that failure is option and success is compulsory. So you should make the right decision, the right choice, so that you'll be better in life.
Know your views. Remember, teenage pregnancy is not an option. Smoking is bad, drug abuse is bad, and let's all love one another and be at peace.
I'm a fellow peer like you. People, knowing information concerning your life is something pretty, because you won't fall a victim of anything, of circumstances like we hear teenage pregnancies, some have got HIV, some, all that come as a result of not knowing information of yourself. So I welcome you to the center. You come, we enjoy, we have fun, we engage in each and everything, we get to know information, we get to know each other, we get to discover our talents, because we do a lot of things here at the center. I cannot wait to see you here.